Hello, guys. Good morning, everyone. This is our lecture for today, and we are all going to talk about the introduction to drugs, how drugs are made, how drugs are marketed, just distributed, and so on. So, this is one of the most important aspects that you need to know about pharmacology. So, we will start out with the definition of pharmacology. Pharmacology came from the Greek word pharmakon, meaning drug, and logia, which means study of or knowledge of. And it talks about the study of the biological effects of chemicals. So that's what we are going to study for the rest of the semester on what pharmacology is all about. And drugs. These are chemicals that are introduced into our body that will cause some sort of change. Let's say, for example, if you're sick and it's caused by a bacteria, let's say tuberculosis, you'll be given anti-tuberculosis drugs, anti-TB drugs that or antimicrobials that will help treat the infection that you currently have. Next term that we have here would be pharmacokinetics or clinical pharmacology. It's also known as clinical pharmacology. It is the branch of pharmacology that uses drugs to treat, prevent, and diagnose a disease. So those are the different functions of the drugs that we usually give to our patients. We use drugs to treat their underlying disorder or disease that they have. Or there are certain drugs that will help prevent the occurrence of a disease. Let's say, for example, drug supplements such as iron supplements can be given to mothers who are pregnant in order to prevent one of the common conditions during pregnancy, such as iron deficiency anemia. Or they can also be used to diagnose certain diseases. Like, for example, barium can be ingested by a patient, which would be very helpful in the diagnosis of certain GI disorders. So those are how drugs are used. Next one that we have here, clinical pharmacology. It addresses two key concerns. Number one is the drug effects on our body. And the second one is the body's response to the drug. So that is what it is being studied here under clinical pharmacology, on how the drug that was ingested or taken in affects our body, or how the body also responds to a specific certain type of drug. Because there are a lot of drugs, there are different responses to each drug that would be given to our patients. Sources of drugs. We have natural sources. For natural sources, it may be coming from plants. That is one of the great source of drugs. There are a lot of herbal plants all over the world that can be used. Also, animals can be a source of drug. Inorganic compounds are also used for the manufacturing of drugs. And if there is a low, for example, resource on plants and animals, scientists can create a synthetic drug, which is quite similar to the molecular makeup of the natural sources of drugs, but they are laboratory prepared instead of it being found in nature. Now we go to drug evaluation. For drug evaluation, under the Food and Drug Administration, or FDA, this is an agency of the United States that regulates the development and sale of drugs. Same thing is true here in the Philippines. We also have our own Food and Drug Administration. So before a drug is going to be marketed, going to be sold in drugstores or pharmacies, they need to seek approval from the FDA. You are, or doctors or pharmacists or scientists are not able to sell drugs without the approval of this government sector. And for every 100,000 chemicals that are identified as being potential drugs, only about 5 end up being marketed. Because there are a lot of things that pharmacists and scientists need to consider. That's why not all of the drugs that are being tested, being manufactured, are sold. I will explain that to you later on. And before receiving the final FDA approval, drugs must undergo several stages of development. And what are they? These stages of development, they start out with the preclinical trials. And this refers to the testing of chemicals with therapeutic value on laboratory animals. Usually rats, mice are being used to test certain drugs that can have a potential to treat a certain disease. There are two purposes of doing this preclinical trials. Number one is to determine whether they have the presumed effects in living tissue. And number two is to evaluate any adverse effects that they can have on the living tissue. Now, at this early stage of drug development, some scientists can immediately discard these drugs or chemicals because number one, reasons for discarding for this or for some chemicals is that they lack therapeutic activity. So it really doesn't work. It does not treat or it cannot treat certain disease. Or number two is it is too toxic. So if it's too toxic, it's a big no-no in the drug industry. It can rather cause harm than cause wellness in a person. Number three, it is highly teratogenic. When we say teratogenic, this means that it is harmful for the growing fetus. And number four, the safety margins are so small. So the drug is not safe enough to be used by any living tissue that would be immediately discarded. But if the drug has passed all of these things under the preclinical trials, it will proceed to the phase 1 of the drug development. During preclinical trials, scientists were using animals for the drug to be tested. But this time, in phase 1, scientists use human volunteers to test the drugs, and they are performed by trained clinical investigators. The volunteers of phase 1 are fully informed of the risks, and they may be paid as well. They should be paid for the phase 1 of this drug development. And volunteers are usually healthy young men. Women are not usually tested during phase 1 of drug development because of infertility issues. What else? Some women may be pregnant. They don't know that they are pregnant. So during phase 1 of drug development, women used as subjects are avoided. So usually the volunteers are young, healthy men. Now, reasons for dropping the chemical include the following. They lack a therapeutic effect in humans, so it does not do anything. It doesn't treat a certain disease, or they can cause unacceptable adverse effects. So it's bringing harm rather than treatment. And they are also highly teratogenic again, or are too toxic in humans this time. not in animals. Now, after the drug has passed phase 1 of drug development, they are now going to proceed to phase 2. And under phase 2 of drug development, this allows clinical investigators to try out the drug in patients who have the disease this time, and that the drug is designed to treat. Unlike during phase 1, healthy young men are used. But in phase 2, they are going to test the drug to a patient who really is suffering from the disease that the drug is intended for. And these patients are told about the possible effects of the drug and are informed about the risks if the patient has consented to participate. So if the consent was given by the patient to participate. So it is the responsibility of the doctors to inform the patient about the risks, about any adverse effects, side effects that the drug is going to have. And during phase 2, this can be performed in hospitals, clinics, or even doctors' offices. If the drug has passed phase 2 of drug development, but before we proceed to that, there are reasons for removal of chemicals or drugs from further investigation, and they include the following. It's usually the same. It is less effective than anticipated, or it is either too toxic again, produces unacceptable adverse effects. Usually these adverse effects, they are harmful, and has a low benefit to risk ratio. So usually the risks or the harmful effects of these drugs are greater than the benefits of these drugs that are being developed, then they are going to be pulled out because it will cause more harm than treat the patient's disease, and is no more effective than other drugs that are already in the market. So if it is less effective than the other drugs in the market, let's say antibiotics, there are already a lot of antibiotics, and some scientists want to develop a new kind of antibiotics. But if the scientists found out that it is less effective than the other drugs that are already in the market, they are going to pull it out. Now we proceed to phase 3 of drug development. Now this involves the use of the drug in a vast clinical market. So if before, during phase 2, the drug is being used in a certain hospital or clinic or doctor's office, this time it can be widely distributed to several hospitals or clinics. It is no longer localized. It can be tested nationally, and prescribers are well informed of the known reactions to the drug and precautions required. We need to observe the patient closely as well to check for any adverse effects. Now, drugs can also be dropped out of this phase during phase 3. And what are the reasons behind? Reasons for dropping the drug include the following. It produces, again, unacceptable adverse effects, or produce unexpected responses, especially when it is used widely. So since a large group of people are being tested here now, the scientists are going to learn sometimes that this drug can be harmful to specific patients. It wasn't harmful to a limited amount of patients during phase 2, but since in phase 3, a large amount of patients are already being tested, and if they found out that the drug is harmful from some of the population that has been tested, they are going to pull it out. Now, FDA approval. So once the drug passes phase 3 of the drug development, it is now going to be approved by the FDA. and it is already going to be named. Um, we have two names to remember here regarding drugs. First is the brand name, and the second one is the generic name. Brand name is also known as the trade name. This refers to the approved drug developed by the pharmaceutical company, such as levothroid or synthroid, while the generic name is the original designation that the drug is given when the drug company that developed it applies for the approval process, like levothyroxine sodium. Another great example for you to know about brand names and generic names better would be the ones that we are usually using, the over-the-counter drugs. Let's say, for example, the local over-the-counter drugs that we have here would be the one that is used to treat fever and pain, paracetamol. Paracetamol is the generic name, while the brand name that we have for it here in the Philippines would be Biogesic. There's another brand name for it. We also have Tempra. So generic name is paracetamol. Brand name can be either Biogesic or Tempra. Another over-the-counter drug that is usually used by patients, especially those who have allergies, would be diphenhydramine. Diphenhydramine is the generic name of that drug, while the brand name would be the brand name of diphenhydramine would be Benadryl. That's it. It's Benadryl. So diphenhydramine, generic name, that brand name, Benadryl. So that's how drugs are being named. Usually, for patients who cannot afford to buy drugs or medicines, especially at our public hospitals that we have here, doctors are usually advising them to buy generic drugs instead of the ones that are branded, because branded are more expensive than the generic ones. So if you've noticed, if you have been buying generic drugs before, they are usually cheaper than the branded ones. Chemical name, this reflects the chemical structure of the drug. Usually this is no longer placed on the label of the drug. Let's take, for example, this one, the levothroid is a brand name. Generic name is levothyroxine sodium. The chemical name would be L-thyroxine or T4. Another example would be the over-the-counter drug. The generic name is Acetaminophen, while the brand name is Tylenol. This drug is also used to treat fever or pain, while its chemical name is N-acetyl P-aminophenol. So that is the chemical name of the drug. We no longer can see this on the drug label. Only the generic name and the brand name is usually seen on the label. Note, generic and chemical names always appear on a straight print, while the brand name is usually or always italicized. But I believe this is no longer being applied to the drugs that are being marketed nowadays. And another note here, the entire drug development and approval process, it may take 5 to 6 years. So class, imagine the development of drugs that can be used to treat COVID-19. We are in a pandemic right now, but like what is mentioned here in this lecture, there are some drugs that may be accelerated. Let's take, for example, Delaverdin or Rescriptor. It was accelerated in order for it to be used by for patients who have AIDS. Where let's take, for example, the pandemic that we are having right now. The drugs that are currently being invented for it is being accelerated because a lot of people needs to use that drug or needs to have that drug for their illnesses to be treated, since COVID-19 is highly contagious. So these are examples of drug labels that we have, like paracetamol, brand name is Biogesic, ceftriaxone, acetyl, brand name is Cefurex. We have another one. It's a drug combination. We have phenylephrine, hydrochloride, chlorpheniramine malate, and paracetamol with the brand name of BioFlu, and an antidepressant with a generic name of fluoxetine hydrochloride. The brand name is Prozac. This is an example of selective serotonin reuptake inhibitor. So it's used to treat depression. And phase 4 now, this refers to the continual evaluation after the drug was approved for marketing. So here, during phase 4, once FDA approves the marketing of the drug, it will, under phase 4, it will still be continuously marketed, or evaluated rather, sorry. It will still be evaluated continuously. If there are any untoward adverse effects that may cause harm to the patient. Examples of this would be dexfenfluramine or Redox, which is a diet drug, or rofecoxib or Vioxx. Legal regulation of drugs are the following: safety during pregnancy. We have category A to D, which I'll discuss that later on, and X as well. Controlled drugs. These are drugs that can have a high abuse potential. I'm going to discuss that in our next lecture, including safety during pregnancy, because we have different categories there of safety, drug safety that can be used during pregnancy. Example there, if the drug is labeled as category X, it is highly teratogenic and it can cause harm or disfigurement in the fetus, or even miscarriage or abortion. Generic drugs, these are drugs sold by their generic names. I've already mentioned that before. And orphan drugs. These are drugs that have been discovered. Usually these drugs are discovered for the treatment of a rare disease. Since the disease is very rare, these drugs are considered to be not financially viable, unlike the other drugs that we have, because there are certain drugs, like for example, the antimicrobacterial drugs, they're used to treat tuberculosis or leprosy. TB or pulmonary TB is very common around the world, so there's a market for it. But if a drug was invented for the treatment of a rare disease, those drugs will be labeled as orphan drugs because they're not financially viable. Only a small amount of the population is having or have this rare disease. And of course, drug companies are not going to market it if it is not financially viable. Another term that you need to know is the over-the-counter drugs, or OTCs. These drugs are available without the prescription of the doctor and can be used for self-treatment, like paracetamol or mefenamic acid. You also have ibuprofen, or the anti-allergy drugs or antihistamines, such as the one that I've mentioned earlier, Benadryl. Those are example of over-the-counter drugs. Even supplements, vitamin C, vitamin A, and so on. Other drug supplements, they are usually over the counter. While controlled drugs, I'll give you an example. Narcotic analgesics such as morphine, they need the doctor's prescription in order for you to buy them because they are highly addictive. Even antibiotics nowadays, they need the prescription of a doctor for you to buy it from pharmacies. So that's it, everyone, for the introduction of drugs. Thank you for listening, and please wait for my next lecture with regards to drugs, to pharmacology, nursing pharmacology, and have a great day. Thank you.